prior to the exam, you want to make sure that you have your patient scheduled in Dentrix about 10 minutes before your op entry time. You want to make sure you go through all the forms and understand them all. You want to make sure you have 2 patient bibs made up with your candidate ID clearly written on it. You want to make sure your instruments are sharp and that you have the radiographs with the patient name, your candidate ID number, as well as both sides of the radiographs and the date they were exposed. And then make sure you have 2 forms of ID.
So on the day of, prior to your patient's arrival, you're going to go ahead and fill out everything you can on these 3 forms here, the dental hygiene progress form and the ADEX dental hygiene stimulated assignment and candidate findings form. So you're going to put the patient name, you can't fill that out yet, but the quadrant, anything else that you can fill out, you'll put here.
Next, you're going to place your candidate badge over your embroidered name on your lab coat, and then check in with the West Floor coordinator for operatory location and instrument check at op entry time. You will then get a tray, a page protector, and a colored folder at check-in.
Okay, so I was told that my op is yellow 24, so I came to my op and I did a quick setup, which is just a bag over the chair and a bag over my tray, and then I'm going to give my patient the bib and then the glasses, and I'm going to have my patient sit here for me. I'm going to pull out my radiographs on my computer for my use, and the ones I print out, I'm going to send it with my patient when she goes to the other side. And then I'm going to take the vitals for my patient, and I'm going to update my patient's charts, and I'm going to update this form as well, which is the dental hygiene and medical history form. The same form that we put our vitals in, we're going to go over with our patient about all the health history and see if everything's the same as before on the chart. And my patient is going to sign and date it, but I will just initial it. I will sign at the very end of the payment. And I'm also going to have my patient sign the consent form. After these 2 are done, I'm going to update the information on my chart, and I'm going to put the CC, everything, and then the treatment alt, and then I'm going to take this to my CI for her to sign it.
After that, you're going to bring them to the chief examiner, which is in the supervising dentist office, and you are going to bring with you your 2 IDs, and then also the patient will have the tray with the printed radiographs, the ADEX med history, the ADEX consent form, and also your dental hygiene progress forms. And you will also have your completed UCDH chart. You are going to obtain initials and signatures on the Med-HX for the blood pressure and RADS, on the dental hygiene form 2, the patient consent, the med history, and blood pressure and planned anesthetics as needed. And then you're also going to get your UCDH chart, health history and treatment records signed.
You're going to give your completed UCDH chart to the West Floor coordinator to put in the chart bin, and then you'll return to your operatory.
So now we're going to do a quick intro exam, and we're going to mark it here on a dental hygiene progress form, and we're going to write everything we see, any tissue trauma we see in the mouth. So I'll make sure my patient's got the bib with my candidate ID and then the eyewear as well. And then on the tray, I will have the dental hygiene progress form that I just fill out with my intraoral exam, and also the dental hygiene simulated patient assignment as well. So those both will be there with the x-ray, printed out x-ray, and then I will also put on top of my tray, I'll have the 2x2 gauze in here, I'll have a mirror, an explorer, and a probe. And I'll put this on top of my patient's tray.
You're going to pass your patient off to a patient coordinator with their tray and their labeled napkin and all the papers that you sent them with, but be sure that they do not have the colored folder because that will need to stay with you, the clinician. They're going to take them over to the official timer table in East Clinic and get ready for their check.
So after giving my patient the coordinator, I'm going to come back to my op, and I'm going to finish setting up my op, get the instruments that I need, and then the extra instruments that I didn't get before. I also get anesthetic if I need to do that on my patient.
After the patient has been checked, the patient coordinator will return the patient back to the clinician in West
So
Clinic.
after my patient comes back, I'm going to check the CFF form, and I'm going to look for my finish time right here, and the probing teeth that I need to do, and then for my calcula check.
Now you will begin patient treatment and clean their teeth, and then you will prepare the patient for the examiner checks. So you'll make sure that the patient is still numb if they needed anesthetic, and you'll complete the forms in the clean page protector and fill out this form. After you finish the cleaning, you will go ahead and make sure that the patient is still numb if they needed anesthetic, and you will go ahead and complete this paperwork, make sure everything is filled out, and you do not change the examiner notations.
After you complete the cleaning, you will provide your patient with a clean new napkin, and then you will also set up your patient tray with the instrument bag with the mirror, the explorer, the probe, and the 2x2 gauze. Make sure your patient still has their safety glasses, and make sure your radiographs and your now completed forms are in the clean page protector.
Now you're going to pass your patient off to the patient coordinator for their final check.
Expect to wait up to 1 hour until patient returns. Do not visit with anyone. Stay quietly in your op. Retrieve your patient's UCDH chart from West Floor coordinator and complete the treatment entry. Tidy your tray and op. Do not clean up. Fill out first half of the candidate survey, and then fill out the remainder of the paperwork, the dental hygiene medical and patient consent with signatures, as well as the DHPF2 with how much anesthetic more that you needed.
The patient will be returned to the clinician, and the clinician will go ahead and review the CQE forms for any errors, and will remove remaining calculus if there is any, and then request a CI check and ask the CI to sign the CQE and UDH chart treatment entry.
Next, you will inform your patient of their next appointment, and then you'll dismiss your patient after deposit is completely removed with CI permission.
Okay, is it okay if I dismiss my patient? Yeah.
And then you'll ask your examiner assistant to take your instruments to sterilization. And then you'll complete any remaining paperwork and charting and obtain CI signatures. And then you'll clean your own operatory and then finish the candidate survey.
Turn in your candidate packet colored folder to the West Clinic coordinator, including your disinfected ID badge, candidate survey, which is green, the dental hygiene medical history, signed by you, the patient consent, signed by you, the CQE, dental hygiene progress form 2 with completed anesthetic record, and then turned it in, signed UCDH chart to end of clinic bin.